Welcome to the Yunique Mind Podcast. I'm Dr. Yuni, a licensed psychotherapist, founder of Yunique Counseling, and a passionate advocate for mental and emotional wellness. This is your space to explore the transformative power of therapy, with a special focus on demystifying hypnotherapy and healing. Each episode will dive into topics that challenge limiting beliefs, unlock the mind's full potential, and empower you on your journey to self-discovery. So take a nice deep breath, open your mind, and let's get started. And today we have Dr. Jamie from Healing Hands Physical Therapy and Bodywork. So Dr. Jamie, tell me a little bit maybe about what it is that you do. I know you do a lot of things, more holistic healing as well, but just maybe introduce yourself a little bit and tell us a little bit about you and what got you into what you do today.
Yeah. So like you said, my name's Dr. Jamie. I'm a physical therapist by trade, so I have my doctorate of physical therapy that I received in 2010 from the University of St. Augustine down in San Diego. When I went to physical therapy school, I had already heard about manual physical therapy. There was a really strong manual therapist here in town that was kind of very well known. His name was Peter Barbieri. And I I had gotten some jobs, it's kind of funny because when I was always told I wanted to be a physical therapist, but when I was in high school, I was an athlete and soccer was my sport, and I had bilateral knee pain when I was 16, where I couldn't run anymore. And so they sent me to physical therapy. And I went up there 3 days a week. I did exercises I was like, I do more than this at the gym. And the PT would come over and stretch my IT band for, I don't know, maybe 30 seconds, maybe a minute, and then he'd walk away, and that was my session. Otherwise, I was following around a kid maybe a year older than me doing the same exercises. And I was like, this is a joke. Like, I can rehab myself.
Right.
And so at 16, I did. And yeah, so then when I got into college, I took all the tests and everyone's like, oh, you want to be a physical therapist? And I was like, no, no, I don't. And, I talked to a counselor and she's like, well, just because you had a bad experience, I mean, I really wanted to do something in medicine at the time. I thought I wanted to be like a cardiologist or something, but I wanted a life before I was 40. So, um, yeah, I got a job at a skilled nursing facility, ironically, because skilled nursing is not my thing. But to work with the OTs and the PTs and to see the level of knowledge that they had, it blew my mind, like completely blew my mind. I was like, wait a minute, you have this much knowledge, and that's how I was treated? Like,
Oh,
I was just fascinated by it. And so, yeah, so then when I decided to go to PT school, I researched the ones that were more into manual physical therapy. Um, because I remember I don't know who it was, but somebody had said to me, they were like, you want to be a manual physical therapist because no one can ever replace your hands,
mm,
right? Like everyone can go and like learn exercises and do exercises on their own, but when you have manual therapy skills, there are things that you can do that no one else can do.
yeah. No,
And
that's
so I took that to heart. And so when I applied to like 10 different PT schools, and I tried to find the ones that had like manual therapy. There's not a lot of them, but University of St. Augustine is very, very manual therapy based.
Mhm. Yeah, I actually had that similar experience. I've gone to PT a couple times, and it was not a good experience. And they were just like, you need to do this and this, but they didn't actually show me, in a sense, or do anything to help me relieve the pain. I had a lot of sciatic pain and things, and literally they would also, like, I think the last one I went to, they just put you upside down on a little.
Oh, on an
Yeah,
inversion table?
yeah, yeah. I mean, it did help to like pull, some, muscles, but it definitely wasn't what I was thinking. Like, is that all there is to PT? So maybe yeah, maybe to kind of describe like what is your kind of specialty? What do you really kind of love when you talk about manual um PT? What does that maybe involve? How do you help people?
So it is hard to put into words,
Mhm,
especially if you have never experienced anything like it. And that's one of my difficulties of explaining what I do. But
mhm,
the thing is, I mean, what all I can say is I'm putting my hands on you, right? So when somebody comes in, first of
mhm,
all, I do a full body assessment. So I look at them from head to toe. How are you standing? What is your posture like? Do you have a shoulder that's more forward on your left side versus your right side? Are your hips do your hips, are they elevated on one side? Is your head tilted? The second you walk in, I'm assessing, right? How are you walking in? What's your pace? Do you have a limp? If you have a limp, where's it coming from? Is it coming from your foot? Is it coming from your knee? So honestly, when you come in, I don't even care what you're coming in for. I'm already assessing and I'm already developing a story
mhm.
based on what your body is telling me.
Right.
And so well, and then I go through and, I need to hear the story because I need to hear from the patient. And this is
Mhm.
something that has truly been lost in healthcare, unfortunately.
Yeah.
Um, there was a great physician once that said, I can't remember who it was. I'm terrible at quotes, but they said, listen, dear doctor, as your patient is showing you the cure. And they
Mhm.
are. I mean, there's so many times that they're like, well, I feel like it's this. But then I have so many patients tell me, well, I
Mhm.
told somebody I thought this was wrong, but they told me, nope, that can't be it. It's something else.
Right.
So, number one, just taking the time to sit down and listen to someone,
Mhm.
it's already a game changer. Like I'm listening to their story and I'm listening to everything that they have to say. In traditional healthcare, with insurance, they only have so many minutes
Mhm.
and they have to speed you up
Mhm.
before they can give you the exercises that they can bill for and get you on your way.
Mhm.
So taking the insurance company of
Mhm.
out of that situation really drastically allows me to improve my quality of care. And so
Mhm.
I have the time to listen. Then I have the time to go through and actually assess and put my hands on you and feel what joints are moving, what joints are not moving,
Mhm.
what tissues feel really tight, one side compared to the other. And then I can, most PTs will manual muscle test you to see are you strong, are you weak, so that
Mhm.
they know what exercises to give. Um, but what I have found, a lot of times people present as weak, but it's
Mhm.
truly, there's a difference between weakness and inhibition. Weakness is that muscle is not as strong as the other side, right? And that can be due to atrophy, lack of use, injury, inflammation, lots of things. Okay. Inhibition is basically, it's almost like it's a neurological disconnect. Okay. So if a joint is not moving very well, your brain senses that something is not correct. And so it will
Mhm.
turn that muscle off.
Right.
It will almost present like it has zero strength. Okay. Like I can strength test. We strength test on a scale from 0 to 5. Okay.
Mhm.
0 is you can't even lift your leg. 5 is you can resist me against very strong resistance. I
Wow.
have seen people present at like a 2 plus, meaning they can't even raise their leg against gravity because their pelvis is locked up. And then when
Wow.
I go in and do manual therapy, which is using either muscles to mobilize the joint, my hands to mobilize the joint, just different
Mhm.
things to release that joint. Once that joint starts moving, I'll retest and they have 5 out of 5 strength.
Wow.
So that's the difference between having someone spend the time and really put their hands on you and find out the true cause. Because if you're going to a standard physical therapy clinic where they don't have the time to do that because they're forced to see so many patients, you could be given these exercises. And I've seen it so many times. People come in and like, oh, I've been doing clamshells and leg lifts and squats and I've been doing all the things, but I'm not getting better.
Yeah.
And it's because they're trying to strengthen a muscle that is turned off neurologically. So
Mhm.
we have to turn that on first
Mhm. Okay.
before we do the strengthening exercises.
Yeah. Oh, that's interesting. So it's almost like almost like intuitively feeling even into the body to see, okay, what is the source of the maybe tension or tightness or whatever to help them really release that too. Yeah. And it
Yes.
talks a lot about people don't probably know what myofascia is.
Mhm.
Even, right?
Yep.
So maybe kind of define what is myofascia, um, and what's the maybe function maybe for our body, because I remember when I was going through all of my pain and lots of stuff and healing that I would just have all this like tightness and tension, and I couldn't figure out what is it, but I finally found somebody to do the to perform what I call ashiatsu on me and then push the myofascia relief,
Mhm.
right? So yeah,
Mhm.
maybe describe what is it and what is it its function?
So, just like everything else, the definition is ever evolving. But, you know, 10, 15 years ago, I would have said what myofascia is, um, and even to this day, I still explain people just so they can get a picture. When you pull apart two chicken breasts and there's that white spider web like material in between, that's fascia. And so it's connective tissue, essentially. Okay.
Mm,
And so what we originally thought was that this fascial system was designed to hold the muscles together and hold our organs together. And it's just kind of everything that holds everything together. It's kind of like the sticky glue. Okay. Um, 20 years ago, they thought, oh, it's just a fascial system and it wasn't innervated and it didn't serve any other purpose. The more research that comes out and they're really studying the fascia, they're finding out that it's highly, highly innervated and that it's actually a big cause due to people's pain. But when you look down to the cellular level, absolutely everything in our body is fascia.
mhm,
Our muscles are comprised of fascia. Our organs are comprised of fascia. Our skin is just a type of fascia. So everything is fascia. So when you're talking about myofascial release, it just, I mean, it's down to the cellular level, but it's every layer in the human body. Even your bones can be considered a type of fascia. And so there are some people who do even like bone work. But it's all about the layer of tissue that you're working on. Okay. So massage therapists do, I know that they will coin the term myofascial release as well because they're releasing the muscles, right? Which is fascia.
mhm,
Um, but there's a lot of different techniques out there that you can do to release different types of tissues, right?
mhm,
So when you're doing like a massage, you're using oil to rub over the skin to
mhm,
kind of get deeper into the muscles, right? Because that's the target tissue. Where for me, when I'm doing my myofascial release, I use no lotion, I use no oil because I want to use the skin as and connect into that tissue
mhm,
and find the restriction. And so I start on the most superficial, which
mhm,
is your skin, and release that. And then you go to the depth of tissue into where you feel the restriction. So that could be a centimeter, that could be a millimeter under your hands, that could be 2 inches under your hands.
mhm,
It just depends on what is happening, and every layer needs to be released. It's literally like peeling away the layer of an onion, right?
mhm, right. So even like I heard scar tissue can hold a lot of um I guess trauma in the body, right? Or whatever's happened there, surgery or even
Mhm.
an accident. So yeah, it's interesting how I've heard people like to also go in and release the scar tissue and kind of break up that whatever that's there that's maybe blocking flow.
Yes. Yes. So scar tissue can hold trauma, and it doesn't have to be scar tissue. Your
Mhm.
tissues hold trauma and they hold emotions and they hold
Yeah.
memories.
Right.
So a lot of times when we're doing body work and releasing the tissues, a memory will come up.
Yeah.
Or um, I mean, it can go really deep. It can be a memory of a trauma that you lived through, a
Mhm.
physical trauma, an emotional trauma. I mean, emotions come up. A lot of people cry on the table because that's part of the healing process is you need, so there's talk therapy of trying to talk through your traumas, but your tissues, your body holds those traumas. And if you don't release them through the tissues, then talk therapy may not be enough. So a lot of times we will even dialogue with people like talk therapy, but during a hands-on therapy session. And that's a lot what craniosacral therapy is.
Yeah.
It's dialoguing the trauma while you release that tissue. And that facilitates like the true healing process because you're releasing it through the mind and the body at the same time.
Yeah.
Um,
So
and
maybe
yeah,
describe that craniosacral therapy because and I'm going to be trying it tomorrow to see, what it feels like. But yeah, so what exactly is craniosacral therapy since you mentioned it?
so craniosacral therapy is a very light hands-on touch. We start with no less or no more than 5 grams of pressure.
Mm,
Um, and now there are different schools of thought just on craniosacral therapy like others, but the one that I use is by John Upledger. He was the founder of it. And the craniosacral system is so it's from the brain to the sacrum. Okay. And it's basically the nervous system because you have the brain and the spinal cord. Around the spinal cord and around your brain, you have a fascia, which is called dura. So lots of people have heard of epidurals
yeah.
because they're going into the epidural space to deliver medication. So that dura is like a watertight fascial system to hold in the cerebral spinal fluid. The cerebral spinal fluid provides nutrition and health and wellness to our nervous system.
Mm,
And that fluid needs to flow from the brain down to our sacrum. So a lot of people always think, oh, craniosacral therapy, you're only working on the head. Well, we work a lot on the head
mm,
because we can use the skull and the bones and the head as a handle into the craniosacral system. But craniosacral therapy can be performed anywhere on the body because it's so much bigger than that. And it's really going into the whole concept behind craniosacral therapy is allowing the body to heal itself.
mm,
So instead of me going up to the body being like, oh, I think I need to treat this, it's more of I'm just going to place my hands on you softly and I'm going to listen. And that, so we look for what the craniosacral rhythm is. And
mm,
that is the cerebral spinal fluid flowing, but you can feel it anywhere in the body. And if there is an adhesion somewhere or a restriction, we will not feel that rhythm. And so
mm,
that tells us where to go. So we're listening to the body, and because there's no rhythm, we're going to go there and we're going to start with really light touch, less than 5 grams. Now, as the body starts to kind of unwind and it wants to heal itself, so I'm just a facilitator and I just listen to the tissues, and the tissues will start to unwind and they will either pull me in or they will push me out.
mm,
So I can get deep with craniosacral therapy,
mhm,
but it's not me coming at it saying, I'm going to do this to you. It's me listening to the body. Do you
mhm,
want me in? Do you want me out? And it's the fascial system unwinding itself and essentially doing its own work. But there's an energy exchange there of a human to human contact, right?
mhm.
And there's something about that. We still don't know exactly what that is,
Yeah.
but let me tell you, it's real because I can
Mm,
feel this happening under my hands. It's the things that I've seen and felt are just unreal.
mm,
Um, and so, yeah, and that a lot of craniosacral therapy is what really changed me into how you were saying, like that intuitive touch.
mhm,
Every time I'm touching someone, even if I'm not doing craniosacral therapy, there's that concept there. I am always listening. I'm lightly touching the body. Where is it calling me to perform? And we listen to what we call the inner physician. And for
mhm,
every person, that's different. Um, in the world of craniosacral therapy, that's what we refer to. It's what's your inner physician? Your inner physician knows how to heal your body from within.
mhm.
Your body can heal itself. It just
Yeah.
needs a little help sometimes.
Yeah.
So
I
there are other
definitely.
people that think more, no, that's God, that's my higher self. and
Mm.
that's fine. It can be anyone's belief system, but there's a greater power somewhere that your
Mhm.
body knows how to heal itself.
Yeah, yeah, definitely. I totally agree. And in my alchemical hypnotherapy training, we call it the inner healer as well, that we
Mhm.
can access through the subconscious and through hypnotherapy. And it is like if you just trust the body will let you know what it needs to heal itself, right? Whether it's emotional release or this physical somatic body release. But it's really beautiful how you can kind of intuitively tell, like, oh, and you're responding to the body. And we really haven't been taught as humans how to listen to our own body, which is the irony, right? We've actually been going to experts and everyone else to tell us what we probably already know, but we haven't been able to trust it, right? So I love how you describe that. Yeah, we do have an inner healer physician who can and intuit all of the things that we probably need to, but we just don't know how to respond to that.
Exactly.
It's almost like that the tissue, I mean, it is not almost, but it is like it's alive, right? It's responding and has its own, you know, consciousness, I feel like, right? Yeah.
100%. And that's so much research is coming out. We've always thought that consciousness was in the brain.
Yeah.
And there's actually a lot showing that it's not even there at
Right.
all.
Right. Exactly.
It's everywhere in us. It's in and fascia has consciousness. And
Yeah.
that's what all the research is coming out to show.
And even when my clients will go back into, deep, hypnosis, they'll find that they had birth trauma.
Hmm.
They don't remember that they had birth trauma but they were there. Our body is like a recorder, and they can literally feel what's happening with the mother, right, in utero, and they'll pop up. They already are stressed. They already have these memories in their subconscious, stored and imprinted, and they can't figure out, well, why do I have such fear, anxiety around this? Like I've never had, traditional what we call trauma, but yeah, you did because that's what you experienced, and in utero as well. So it's so amazing.
Yeah, exactly. I just took a pediatric craniosacral therapy class a couple weekends ago, and there was a woman there that they actually one of the treatments was you should go back and intentionally try to go through your birth experience. And the woman that I was working with, she completely went back. She'd never heard her birth story ever. She knew that she was in a car, that she was almost delivered in a car. So she was born in Czechoslovakia. Um, she came out of the womb and she said, "My arm hurts. What are you doing to my arm?" And then she said, "I feel feverish." And she was shaking and she was very, very cold. She kept saying, "I want my mom. I want my mom." She told me her whole birth story that she never heard before. She called her mom that night and she said, "Was I born in a car?" And her mom said, "Not quite, but almost." She said, "Was I given a vaccine right away?" And she said, "Yes, you were, and you had a bad reaction, and you were in the hospital for 6 or 7 days because you had a fever."
Yeah.
And she said, how do you know this? How do you know this? I've never told you this."
Mhm.
It's fascinating. And I've seen that happen multiple times with craniosacral therapy. It's
Yeah.
unreal.
Yeah, so you kind of described maybe a cranial therapy, sacral therapy is similar to like what people will say like hypnotherapy experience, or maybe with the even regression, right? If we go back into the
Mhm.
old terminology of childhood regression and going back to those really, I mean, pre-conscious, years. So yeah, I'm excited to kind of see, how similar or different it is to the
Yeah.
hypnotherapy.
Yeah.
Yeah, so anything else, maybe around that, you feel is important for people to know, like, about, I mean, obviously it's not painful. It's almost very cathartic. I think people get afraid to kind of just be in tune with their body a little bit more, but yeah, it seems very gentle process and yeah.
It's incredibly gentle. It's incredibly soothing.
Mhm.
And not everyone has those types of experiences. Like you definitely have to be open to that kind of concept to have that. I'll even say I've had past life regressions. I have not been able to experience my own birth.
Mhm.
Um, I definitely have a block. It's kind of funny that I can like do this for people, but I can't go too far myself. But that's, we all have our own healing journey.
Mhm.
Um, so it's whatever we meet you, we meet you where you're at. You meet the client where they're at. And so everyone's different. There are some people that come in and it's just relaxing. They might just fall asleep on the table. They may not experience anything. Um, 9 out of 10, like I may not even tell them what I'm doing, and I'll always do like I have people come in just for regular physical therapy, and I'm just doing regular body work, but I always end with the suboccipital release that puts them into a parasympathetic rest and digest state. And so it's taking you out of fight or flight and putting you into rest and digest. And it can, for people that are like, well, I can't meditate because my mind's always racing, right? It's like, well, that's kind of the point, right? And so nobody gets off the couch and runs a marathon. So I wouldn't expect you to go sit down and meditate for an hour. Like try
Mhm.
30 seconds. But the beautiful thing is with cranial, it almost kind of forces you into that. It
Yeah.
just, and not with everyone, some people can't shut down. But it was funny. I was working on a friend of mine, and she's a anesthesiologist and had never experienced cranial before. And I started doing some cranial on her, and at the end, she was just like in awe. She's like, what was that?
Mhm.
And I was like, well, what did you experience? And she was just like, for the first time in my life, there was just nothing.
Yeah.
Like just I was just present. I was not thinking about anything. I was just on the
Mhm.
table, feeling what you were doing, and I could feel my spine relax and I could feel my whole body relax.
Mhm.
And it can just be super powerful of that, of just you kind of just feel like you like sink into the table
Right.
because it gets everything to turn off and just relax because we can't do that in this day and age. We're just go, go, go in fight or
Yeah.
flight all day, every day. And in that state, our bodies cannot heal.
Mhm.
So
Mhm.
just taking us from sympathetic fight or flight to parasympathetic rest and digest, that alone allows your body to heal.
Yeah, for sure. I call it kind of, that's the experience when people go and to meditate or doing the hypnosis is really the place of stillness, right? Or the
Exactly.
void of nothingness, right? And that is almost like the peace is very peaceful and very like, oh, this is surreal. Just this is
Hmm.
what it feels like perhaps when, well, people will say it's like feels like nirvana or bliss, right? So yeah, it's the absence of all of the noise and the chatter, right? Yeah, the
Hmm.
silence. So I love that. And people can definitely be trained to drop into that state. And so I practice TM meditation all the time, and I feel like that's the place that we go to, that we need to really start to reset our body and let go of all of the stress of the day. But
Hmm.
it's beautiful too, and you have other modalities that you can get to that state.
Hmm.
Yeah, I'm excited to try
Yeah.
it.
You're gonna love it. You're gonna drop right in. You're good. I'm excited to try hypnotherapy with you.
Yes, yeah. I mean, I feel like it's very similar just to get to that altered state of consciousness, right? And people don't really know what it is to just rest and digest and be in that parasympathetic state. Yeah.
Yeah, they don't.
Okay. So yeah, maybe tell a little about other services that you offer. I know dry needling, you do nutrition or exercise education, um, even cupping and StemWave. I wanted to get to that too, but
Yeah.
yeah, there's so many things that you offer that are really or holistic. That's non-invasive, right?
Mhm.
Other than maybe the dry needling. I don't know. Talk a little bit about.
Finding a link is definitely invasive, but it's like I said, I'm always meeting the patient where they're at,
Mhm.
right? So there are some people who really don't want deep tissue and they want something gentle, and maybe they have fibromyalgia, so every time I touch them, they're jumping off the table. I'm gonna jump for craniosacral therapy first, right? Like I'm gonna calm their nervous system. I'm not gonna give them deep pressure, right? Now, if I have a bodybuilder that comes in that, oh, get this muscle, it's just super tight. Ah.
Yeah.
Yeah, I'm gonna, okay, give me a needle. I'm gonna stick it in there. So, dry needling is it's using, so it's not acupuncture. I mean, although there is some crossover. I know there's some frustration from some acupuncturists that we are doing this, which at first I didn't understand because the class that I took, I was like, this is so not acupuncture because the one that I took is very specific. Like there is a trigger point. So it's your tissues get very, very tight and balled up, and they're so tight that the blood cannot actually get to the area. And so, I mean, everyone knows what a trigger point is because everybody has that one on like the back of their shoulder and their neck. And it's like, oh, there's a knot right there. That's a trigger point. Okay. And so physicians will do trigger point injections. Okay. So they use a big hollow needle to inject medication into that trigger point. But different physicians were using different medications. So, like one physician would use like a muscle relaxer and a steroid and lidocaine. And then this one over here was only using lidocaine, but they're both getting the exact same results.
Mhm.
So they're like, well, is it the medication or is it the needle? So then they started just the needle, same result. So they're like, well, why do we need to use this big, thick needle? What if we used an acupuncture needle, a monofilament needle that's very thin to go in there and just break it up? Same results. So you can go to like pain management and they can inject you with trigger point injections, or you can just get dry needles.
Mhm.
Um, and now, however, I will say now there is some crossover because there is the education out there that like once people started using needles and they
Mhm.
heard about certain meridian points that people would use for acupuncture. And so I can see where the acupuncturists feel like they're getting their toes stepped on.
Mhm.
Um, that's not, I don't do anything like that. It's based on palpation. If
Mhm.
there's a tight tissue, then I'm going to insert it in that tight tissue. We can connect it to electrical stimulation as well, which is actually really cool because, you know, a lot of PTs will use tens with pads, and it just that works on the gate pain theory, basically that pain travels slower to the brain than any other sensation. So it's the same thing as when you slam your thumb in the car door and you find yourself holding it or rubbing it. You're giving it a different sensation than pain because that travels faster to the brain. So when you have those pads on and it's giving you like a little vibration massage, that's
Mhm.
what TENS does, is it's just kind of beating that to the brain, which can then allow the muscles to relax a little bit and increase a little bit of blood flow. When we connect needles that are deep in the tissue and in the muscle to that type of stem, it can further relax the muscles. And then we're actually getting in and really treating the nervous system. And once again, trying to get you from that parasympathetic fight or flight to the or sympathetic fight or flight to parasympathetic rest and digest. And so that's how we utilize dry needling. So it's just another tool for different people that want something a little bit more aggressive, or if we're trying to get in deeper, down
Mhm.
towards like the bone if we need to. Just a
Right.
different tool to have in my toolbox for different people.
Yeah, so it's interesting. We keep saying the words like just relaxing and releasing, right?
Mhm.
Yeah,
Mhm.
and that really is how our body will need it can really heal itself in that rest and digest parasympathetic state. And that it's so ironic how we all are just in that survival flight or flight mode where, trauma mode we call it. And where we don't relax, we don't know how, because then the muscles and the body starts to be in that protective, I call it turtle mode, right? We're in that stuffed in that little shell all the time. And so it's interesting how all of these modalities, but really is just helping us to like let go, right? Let
Yep.
release whatever is trapped there, right?
Yep.
We tried the trigger point injections, and I think they use lidocaine, but I mean, and I had sciatic nerve pain for many, many months, well, years. And that helped some, but it didn't release all of it. It was still some emotional trauma I had to work through as well, right? So it sometimes all you can do all of the modalities, but then of physical stuff, but like there you got to work on sometimes that emotional or those blocks as well that's there.
100%.
Mhm. So you talked about the TENS unit. Yeah. And it's interesting how you're putting all of those modalities together, right? Before it was just like this and that, but then now you kind of integrating a lot of those particular modalities together. So I think that just exponentially helps. Sometimes they say more is not better, but sometimes it is.
Yeah, and I don't always do all, yeah, more is not better. I'm not going to do all of these things all on the same visit because we need to know it works. But, some people decide to be a craniosacral therapist, right? And they're going to take all the craniosacral therapy classes, and that's their modality because
Right.
they love it and they're good at it, or they had a great experience with it, or they do muscle energy technique or they get really good at joint mobile or joint manipulations. Like that's their thing, right? For me, I'm just different in instead of taking, I mean, I take a lot of classes in each thing that I do, but instead of taking all in one and having one lane, I have different tools in my toolbox so I can be like, okay, let's try this. Oh, that didn't work. Okay, let's try this. Oh, okay, when that didn't work, okay, let's try this. Versus having to try all these different practitioners, you can hang out with me for a little bit and we're probably going to find what works.
Yeah.
If not, I have a lot of connections where I'm happy to refer out. Where, okay, we've tried all these things, this isn't working. We got to try something else. So
Yeah.
maybe you need to go see this, or this person.
No, that's what I love about your services and what you do. But even I was just looking on your website. I mean, you break it down, but it's like, when you think about traditional PT, that's not what you think of, right? So
No.
it's so interesting how you're using a lot of those modalities together to help find what is going to work for people. And then I wanted to talk a little about the STEM wave, right? The STEM wave that and some people will call it, I think, shock wave.
Shockwave. So it's a form of shockwave.
Mhm.
So what shockwave is it's using sound waves, okay, to penetrate the tissues into thinking that there has been micro trauma. So shockwave, it's not necessarily, I mean, in some cases it's replacing things like stem cell injections.
Mm,
Now, I've seen people who have done shockwave therapy and it didn't work, so they got stem cells. Or I've seen people who did stem cells and spent $10,000 and it didn't work, and then they come and they have shockwave and that works. It's just you don't have to use the needle. You don't have to pull out your own blood, your cells, anything like that. It's a wand. You put it up against the tissue, and it delivers a very high amplitude sound wave that shocks the cells into thinking there's been micro trauma, even though there hasn't been, which pushes out old stagnant inflammation and it brings in the fresh new healing process.
wow.
So we have StemWave, which is one of the higher ones on the market. There are all different kinds. There's like radial, there's piezoelectric, we have the extracorporeal electric stem wave, and it penetrates deeper and it's a little bit more specific.
Mhm.
As far as I know, the two that are the most powerful on the market are StemWave and SoftWave.
Okay.
Um, so yeah, sometimes I'll get the question of like, oh, well, my chiropractor down the street, they're charging $99. Why is yours 200? And it's
Mhm.
like, well, yeah, that will still work, but maybe for something like a superficial tendonitis, because it's really superficial and close to the skin.
Mhm.
And maybe you get treated 20 times for that $100,
Mhm.
and then you get the same effect where we can do it in 10,
Mhm.
and we can go really deep. So the stem wave goes, I think it's 3 centimeters. It can go as that deep into tissues.
Okay.
So so what's beautiful about that is this is how I use it. So if somebody comes into me and they've been told that they need to have a knee replacement, in the past, I'm like, well, we might be able to postpone the knee replacement or even defer it
Mhm.
because if the knee is the weakest link, it's always the weakest link. Like I would say, knee pain is not a knee problem. It's usually a hip or a
Mhm.
ankle problem. Okay. So if the hip, kind of how I was saying before, if the SI joint is not moving very well, then the muscles around the SI joint get inhibited. So your glute med gets very weak. So then your knee dives inward. So you're getting increased pressure on the inside of your knee or on the outside of your knee, depending, maybe the patella comes to the side and it grinds against the femur. Or if your ankle isn't moving, then you're going to have to like limp over that ankle, right? And you're going to
Mm.
overutilize the knee. So you have to think about when you get arthritis in a joint, it's usually because there's a joint nearby that's not moving very well. So then you have to use a joint too much. And
Oh.
that joint that's being used too much, that's the one that breaks down. And
Mm.
so the tissue gets deteriorated, you have no cartilage, you have no meniscus, and then boom, you get bone on bone, right? And then you have this painful knee. So how I treat that is I'm going to go look at the pelvis, I'm going to get that moving. I'm going to look at the ankle, I'm going to get that moving. We're going to find those muscles that because, excuse me, because they've been inhibited for so long, now they are truly weak.
Yeah.
We have to facilitate them first. Then we get you strong. Well, that knee is still arthritic, right? So sometimes when we do all the manual therapy and the strengthening, we get it moving enough that it's like, oh, my knee doesn't hurt anymore. I don't need that knee replacement.
Yeah.
But then sometimes we get someone where it's like, "Ah, like, yeah, I can tell I'm moving better, I'm stronger, I feel better, but my knee is just still so painful. I need to get it replaced."
Mhm.
So StemWave can go in. We no injections, no medication. We use the wand. It pushes out the old inflammation out of the bones. It brings in fresh new healing. It heals the bone, and
Mhm.
people are not having to have knee replacements.
Wow, that's amazing. Yeah, I didn't even know that that was possible. Because yeah, surgery, we think about surgery sometimes is probably what the traditional therapist will or doctor will, recommend because they don't know about this technology. And so,
And it's what insurance covers. So once
mm,
again, insurance dictates care. Unfortunately, insurance doesn't cover shockwave therapy yet.
wow.
So it's unfortunate that people have to choose. Well, do I want to spend a little bit more money and not have surgery? Which I will tell you any day of
Yeah.
the week, it's not more money. It's less money in the long run, let me tell you.
Yeah. And
Any
having it.
surgery comes with so many complications. It's not even funny, and you don't want to mess with those. But I always just say try the most conservative care first.
Mhm.
If you end up still having surgery, then you know, A, you tried absolutely everything that you could, and
Mhm.
B, no matter what you do, if it facilitated the healing process, it's just going to make your recovery after surgery easier.
Yeah, for sure, for sure.
So,
Wow. Yeah, then yep. And it's unfortunate that insurance doesn't cover it because, it was more cost effective exactly for them too, right? And less recovery for the patient. So, yeah.
exactly.
But yeah, so I'm hope, all of these particular what people call alternative holistic methods, right, are usually they actually work, right? If we, have access to them or understand, how to get access to them. So,
Yeah, and that's just, I mean, it's hard trying to get the word out. And people are just, all they know is they go to their doctor, okay? Their doctor sends them, oh, you have knee pain. They're either A, going to send them to physical therapy, or B, they're going to send them to an orthopedic surgeon. Well, what is the orthopedic surgeon going to tell you? They are a surgeon, they cut. So
yeah.
they're going to recommend surgery. Nothing against them. That's what they know works. That's
Yeah.
what they're going to offer you. But they need to stop being the first recommendation. They need to be the last recommendation. And so it is starting now. We are in this
Mhm.
change in healthcare where people are realizing that insurance is not in their best benefit. Insurance is a business.
Exactly.
So, yeah, you've got to, I mean,
Yeah.
yes, they should be covering all of these things. They should be,
Mhm.
but they're not. And that's where we are right now. Hopefully things start to change.
Yeah, and that's one of the reasons I think I'm doing this podcast is because people need to know this information and have access to it and know that there's more out there than what the mainstream is, telling them. Um,
Exactly.
I know you also do, the pelvic floor therapy, which is really important for, I don't know, for especially women after giving birth, thing our pelvic floor gets weak or it's actually also can be too constricted, right? We don't know how to relax, which is the irony.
Well, and that's a lot of what pelvic floor is. So a lot of people think, oh, pelvic floor physical therapy, I just need to do my Kegels, right? But I always say a tight muscle is a weak muscle.
Mm.
So I'm talking about releasing all these muscles because they can't fire, they can't be as strong when they are contracted. And so pelvic floor physical therapy is a lot of releasing those muscles so then they can be strong. So then they can hold in your urine, they can hold in your bladder, your uterus,
Mhm.
all of those things. But I mean, men need pelvic floor physical therapy too, and that's not discussed very often. It's pelvic floor is not just the vagina and pain with intercourse and peeing yourself. It can also be anal pain. It can also be constipation. Um, it's just anatomy that it's muscles. It's a pelvic sling on the bottom of your pelvis that holds all of your organs.
Yeah.
All of your organs are sitting on top of them. So if
Mhm.
they're tight and they can't be strong, then you're going to have dysfunction.
Mhm. Yeah, that totally makes sense. Yeah, I didn't know that that was men needed it too, but I guess yeah, they have a pelvic floor as well.
Exactly.
Yeah, yeah.
Yeah.
Well, that's fascinating. Um, yeah, so anything else maybe you want to share that's really important that anything else?
I mean, also something that we've really gotten into is nutrition and
Mhm.
supplements. You know, gut health is everything, and everyone's been talking about that lately. Now, I have all these things. I want to know everything if I possibly could, but I don't have the time or the resources, right?
Right.
So, but specifically, so Varsha is my pelvic floor physical therapist. I've always wanted to learn pelvic floor, but I'm like, I just can't put anything else on my plate. So she's specializing in that. And so with pelvic floor, like I said, really comes constipation. And so, and anything with anything that we do, I'm always talking nutrition because if we have inflammation in our bodies,
Mhm.
the first thing you need to look at is what are we eating? What are we drinking? We are what we eat. We've always been told that, but it's really very true. And there's so much research coming out now that our immune system has everything to do with our gut health, right? And so um, I actually have some background with this, so I know quite a bit about it, but I haven't had like a ton of like formal education on it. So with functional medicine doctors, it's a lot of how can we treat you with natural herbs and supplements instead of medications. So there's a company that I've partnered with. It's called ID Life, and they try to do the functional health aspect for me, essentially. So they are backed by science. You can
Mhm.
take an online free assessment, and you tell them what you eat, what you drink, what you exercise, your height, your weight, your sex, where do you live in the country? Because they want to know how much vitamin D are you getting? Like not just based off what you're saying, but like where do you live and like how much sunshine is there available? And it's a pretty vast questionnaire. And then what they're doing is they're testing. Um, so there's a genetic test that they have you do. They used to just look for the MTFHR mutation, which is like, are you able to detoxify and are you able to process folic acid? And now they're finding, so they're saying that 50% of the population has the MTFHR mutation, but I think it's more like 80 or 90 now. So if you have the MTFHR mutation, you cannot process your B vitamins. So you need to take a methylated form of your B vitamins. But there are the tests that they're doing now, there's like 16 different genes that they're testing for to see if they're
Mhm.
mutated. And based on if you have a mutation, they're going to change your supplement. And each one of your supplements, you get like a little packet. It's not like a bottle, right? Like a bottle of this, a bottle of that, that's the same for everyone. They actually ship you yours, and in your packet, it is designed for you, not for your husband, not for your sister, based on your height, based on your weight, based on your sex, based on your nutrition, based on your genes.
Huh.
And so that is drastically helping gut health because all these people are taking these supplements. But
Mhm.
what people don't realize is if you're taking a supplement from this company and then you're taking a supplement from this company, and then
Mhm.
maybe you're taking this medication, they can be interacting
Yeah.
and they put you have to put in all your medications and they put it into a vast AI to double, triple check so that they literally will not allow you to order a supplement that is contraindicated with like a medication or a condition that you have.
Wow, that's amazing. Yeah, what's the place that you're working with that
Called ID Life.
ID Life? Okay.
Yeah.
Yeah, that's fascinating. Yeah, and even me, like I get oftentimes like nausea when I take too many supplements, right? Yeah.
Mhm.
And it's probably because our body can't, metabolize it. It's not really made for us, individually. So that's really a great idea.
Yeah.
Um, okay, so I know we're about out of time. So maybe tell everyone how they can find you if they want to work with you.
They can find us at our website. It's at healinghandspt.net. Or they can always call or text us. So we're in Reno, Nevada. Our phone number is 775-452-4471, and they can call or text that. We're also on Facebook, Instagram, and TikTok, and we also have a YouTube channel. And it's all Healing Hands, PT, and Bodywork.
Beautiful. All right. Well, thank you so much. And I think we were going to start to kind of also maybe do a segment on each particular modality, maybe get a little bit more in depth and maybe, can help clients, or if the clients want to like, maybe do some sessions and while we record them, that would be awesome, because then it kind of takes the stigma out of the and more education for people. So I'm even thinking about offering hypno sessions, for people to and record them, but some people are a little hesitant to show their, but
Yeah,
they like to
that
say
one's tough. Yeah.
but we definitely it will take kind of the mystery out of what are these services that we're offering. But I feel like people really need to know that information for sure.
Yeah, I do too.
So thank you so much for being here. Much love and gratitude for tuning in to the Yunique Mind Podcast. I hope today's episode gave you new insights and tools to support your healing and wellness journey. If you enjoyed this conversation, don't forget to subscribe, leave a review, and share it with someone who might benefit. You can also reach me via my website at uniquecounseling.com, and that's unique with a Y. Until next time, stay curious, stay mindful, and keep exploring your unique mind. This podcast is for educational and informational purposes only. While I am a doctor, PhD, this podcast does not create a doctor-patient relationship, and the information shared should not be considered medical or psychological advice. Always consult a licensed healthcare provider before making any decisions regarding your health.